guys like?
Welcome, everybody. It seems a bit embarrassing to use a microphone, but I've actually been looking forward to this session, and I volunteered to moderate it because I was really interested in it, really interested in the content. Um, Chris is going to talk to us about legalization of cannabis and sort of what that landscape looks like a number of years later. Um, People are welcome to stay where they are. They're also welcome to move up if they like, because we have no shortage of seats. And I think it's pretty clear we're going to have lots of time for question and answer. So, welcome.
Thank you very much. I'm not actually talking. Thank you. I'm not actually speaking about legalization of cannabis. Okay.
Come in the much room.
I thought I was being punked for a minute. I wasn't. Yeah. I can probably talk around the fringes, but I don't think you really want to hear me go too deep on that. Well, okay, so I can use the microphone. If it gets too loud, I can step aside. If I step aside and you can't hear me, please let me know. Thank you very much, Dave. Thank you for inviting me and for including me. As you work in areas of health that affects my family, I'm really pleased to be able to help in some tiny way with your work and the organization's work. Really happy also to be in Hamilton. I don't know if there's any locals here, so I'll refrain from saying how much I'm looking forward to the Argos and the Grey Cup tomorrow, but there we go. So, yeah. Blue Bombers, yeah. Oh, yes, that's right. Yes, of course, yeah. Didn't think about how that one was going to go over. Yeah, that's it. We're out of here. I'll go. You know what? Because it's not a huge group. If you want to stop during and ask questions, I'm fine with that. Okay. So a bit of an agenda we'll introduce. We're going to talk about advocacy and communications, kind of big picture, and then the work that we've been doing with CSAM and how we would like to move forward, and also just talk about some of the issues around the efforts to do advocacy and communications. So I hate doing this stuff, but I think it's probably important you know somewhat about me. My background is in communications and advocacy, obviously. I started working in politics and on political campaigns and Parliament Hill and City Hall in Toronto and Queen's Park for a long time. And then I realized that's not really a full-time, lifetime job. So I worked in public relations, and then about 15, 17 years ago, I went out on my own, and I do public policy consulting, communications, media relations, all for nonprofits, NGOs, grassroots groups. Those are kind of the areas that I've worked in. I do a lot of work in healthcare. If there's an organization, if there's been an initiative in the last few years that I've had the name doctors in front of it, I've probably worked on it. Doctors for Refugee Care, Doctors for Protection from Guns, Doctors for Medicare. So those are all kinds of initiatives I'm working on. So I'm a bit familiar with your time constraints and other areas where you can work and how you like to make a difference. But just to give you a bit of background on that. And then personally, I'm involved in civility, civil discourse, civic engagement initiatives, and I do a lot of writing and media analysis as well. So I was invited to give some background, and I know you heard from Senator Kuchar, so I'm going to hopefully not overlap much. I don't think I will. To talk a bit about why it's a good idea for CSAM to advocate, to be involved more publicly, and how I can support that, and also some very specific things that we can do. So to get into a little bit about strategies, and I want to hear from you if there's areas where you think the organization should be more present areas to be, policies to be working on, ways to raise an awareness about addictions, and and then get into a little bit about the social, political, media context that we find ourselves in right now, and and how we can prepare for that. So the why advocate. This is pretty straightforward, but from your role, you're advocating for your patients daily. So does it make sense to do that on a macro level? Does it make sense if people are struggling, if people are having trouble accessing services, accessing care, accessing medicines? Is there something that we can be doing collectively to change that? I think everyone's probably very aware around issues around harm reduction and the politicization of that. Is that something that's a concern? You're representing your patients, you're giving a voice to others, but it's also just, it makes sense as citizens. We all have a responsibility. How many people have met with their member of parliament or MLA on an issue that they care about? Yeah. Written a letter to the editor of a newspaper? Yeah, right. So sent a tweet or a social media post. So you're all, yeah. So you're all, you're all advocates now. What can we do collectively as an organization? Now, and why should CSAM do this? Well, it's right in your mission, right? It's really clear. I've worked when I've come into working with other organizations. A lot of the times, they're advocating in their individual practices, but collectively they're not. Why would we do that? Well, again, it's about serving your patients, and also it's part of the public interest. You're involved in public healthcare. You're involved in public issues. It makes sense to be involved in the public policy side of things. It's also quite good for business in terms of the organization. Others who in this practice area who maybe don't already belong, see the work that's doing, want to get more involved, want to join. Those are all things that's good. And a big one, if you're not out there, if you're not speaking about best practices, about the evidence, somebody else is going to be filling that void, and that's not necessarily good.
Sorry to interrupt. We're recording, so if you can stick closer.
Oh, stay close to the mic. Okay, sure, no worries. So for CSAM specifically, what are the kinds of things that you can do? Well, obviously, you work on evidence. You go through the evidence, you publish in journals. Can that information be translated and shared more widely with the general public as an education piece, with policymakers, with allies, with other stakeholders, with other organizations you work with in the health sector and beyond? The personal stories piece is really useful. Respecting patient privacy and all that. You're also aware of individual personal stories and your own stories as practitioners and how that's affected you, what you've seen, how you've treated. These are all things that the general public, policymakers, other individuals, they don't think about day to day, and they're really, really compelling. One of my other projects I've worked on is gun control, and one of the things that we thought, we're trying to build some awareness at the time. So we asked some of the members of the organization, other physicians and some other healthcare workers, could they provide a little blurb on treating a patient? Maybe they're a surgeon, maybe they're working the ER, maybe they're a psychiatrist and they're counseling somebody after the fact. And the individual stories we got back were just, they were heartbreaking. They were incredible. In some cases, they were terrifying, but they were super, super compelling. And we put them all in a booklet. And that really became, we sent it to all members of parliament and senators. And it became a real way of people understanding the impact of gun violence on a very individual micro level beyond just what the newscasts say, right? And then the other piece, and this is a little bit more of an approach, but being for dealing with government officials, dealing with media, being responsive, being available, obviously being reasonable, which you already all are. Those are all things that helps in your work in a public policy agenda side. Okay, Holcroft, you've convinced us we should advocate. So how do we do it? Well, the first thing you want to do is you want to have a bit of a plan, right? You want to develop what is our purpose? What is our goals? It's not great to say, oh, we want to advocate. We want to be out there. We want to stand up for our patients. What specifically do you want to do? Are you concerned about sports betting? Are you concerned about access to medicines? Are you tired of the narratives around harm reduction, safe consumption? Whatever the case may be, what do you specifically want to work on? You need your strategy. What elements are we going to focus on? Policymakers? Is there specific legislation we need to influence? Do we need to be out in the media? Should we be attending other conferences? Should we be working with other stakeholders, other allies, collectively, with patient groups, with other healthcare organizations, with community organizations, to have a bigger footprint? Those are all things you want to consider when you're developing a plan. And you want to have timelines. Are we working on this forever? Is this a very specific piece? Is it around a piece of legislation and there's a timeline? Legislation is going to move forward certain steps. It's going to pass or it's not. Or is this just it's a long-term, we're trying to, shift the discourse, right? We want people to think differently about this. And it's not going to happen overnight. That's a longer term project. What are your goals? What are your timelines? And then obviously, and we'll talk a little bit this later, and then getting into, what are your messages, right? And we'll talk a bit about that later. So there's many tools for advocating, and you can at both an organization level, but then also equipping your members to be able to advocate. Now, many of you, from based on the hands, are already do that individually, so you're already comfortable with this. But it's about what are the steps that we can take. And on the advocacy side, some very basic things for public policy, right? You can speak to members of parliament. You can ask for meetings with senior legislators, senators, ministers, chiefs of staffs, right? You can submit briefs. You can proactively do it, but usually it's reactive because there's a piece of legislation going through. CSAM has been doing a lot of that lately, right? It's really important. You're responding anytime there's a piece of legislation. I think Senator Kuchar went over this, right? It goes through. It goes after if it's the House or the Senate, after it's been voted on, it'll go to committee for review and further study. There's a public or at least a stakeholder component to that, and there's an opportunity to come in and provide feedback. You can either go in person sometimes to speak to the committee, or you can at least submit a written brief that will be part of the public record, is reviewed by all the committee members, and can have an influence on where the legislation is going. You can also do things like stakeholder roundtables, conferences like this, protests, right? These are all elements that are part of the advocacy, either in the street or in the halls of government, or in roundtables with other like-minded organizations. Grassroots level, pretty straightforward. You meet with your local MP once a year. Maybe you attend community organizations. It's a bit corny, but sometimes having a table at a neighborhood group or a community festival when there's an area for nonprofits, and you're out there and you're talking about the issues. I've had organizations do that and very successful. On the public discourse side, so media relations is a big piece of it, but it's not all of it. There's writing opinion pieces in newspapers. There's putting out a press release, a statement responding to an issue, proactively trying to address something. You can hold a press conference. This example is that picture is from a press conference I organized a few years back. Access to medicines was there was a bill going through the House to give licenses to generic drugs to be sent overseas, developing countries, to deal with issues like tuberculosis, HIV, malaria. It was very contentious, but there was a lot of support and we were very close. And on the eve of the vote, we were trying to do something to get it over the finish line. And there were advocates who had been speaking about, not necessarily involved with our campaign, but they'd been actively done individual things. Decided, what if we could reach all those people, bring them all together, do a press conference on Parliament Hill? And so what came together was Stephen Lewis, who was the HIV, the AIDS envoy at the UN at the time, Dr. James Arbinski, who was fresh off running the MSF and wrote a book, and then Kanan, who's from Somalia, the singer. It was right around the waving flag song time, right? Very popular thing. And then my client Richard Elliott's on the left, and it was. I'll tell you, I've never attended a busier press conference. Now, that was a special thing. It was a way of using high-profile people who cared and who were aware. And that, of course, generated a lot of attention, a lot of buzz on Parliament Hill. The vote passed that day. It's not always going to be like that. You can also do little social media posts, advertising, right? And National Provincial Awareness Days. We've done this. We've launched. We got I have food allergies. One of my clients is Food Allergy Canada. We pushed and we got a designation of Food Allergy Awareness Month. Now it's a month where policymakers will make statements. It's an excuse to get meetings, to be in the media, and that. And I know there's a Addictions Awareness Week, I think, and it coming up in a couple of weeks, and that'll be an opportunity for CSAM to do some media around then as well. And at the grassroots level, same kind of thing, writing letters together, talking to your local journalists, sharing individual, sharing evidence, sharing research studies on your social media feeds or within your community networks. Okay, so now some considerations, and this is not limited to CSAM, this is with other organizations. You want to do a lot, we want to be out there, we want to be proactive. Well, how much time do you have, right? So you're all busy. And of course I work with a lot of medical groups, so I appreciate that. You've all got busy practices. This is a side piece to what you're doing. You available? Do we have member buy-in? Is this just my idea I'm pitching to you? Is it just Aaron's idea or Dave's idea? Is there going to be enough stuff? If you want to have campaigns, sometimes it's just the co-chairs of an organization writing an op-ed. But if you want to have a bigger impact, you might be asking your members, could everyone take 5 minutes over the next week and send this letter that we've drafted that you can tweak if you'd like to whatever, the Minister of Health, to the Minister of Mental Health and Addictions, whatever the case may be, right? You want to engage people. Another consideration specifically on these kinds of issues, but public understanding and patience with complex issues. And we're going to get into some of that about why that's becoming a bigger issue. You've also got, of course, government attention spans. They're short, right? That's not all their fault, right? I've worked for and worked with a lot of public officials, and for the most part, they want to do a good job. There's a lot of information that comes their way. There's a lot of files on their desk. Why are they going to choose to work on this one as opposed to that one? Right? Media concentration. So as everyone kind of knows, I know like the Halifax paper is now part of the Halifax Herald, a great independent paper, is now part of the Post Media network. It's becoming harder and harder. You put out one op-ed. You used to, okay, well, we can pitch this place or this place or this place. That's narrower. Meanwhile, social media has gone the other way. It's fragmented. There's lots of networks, lots of sites. It's got its own issues. And then, the last piece, we're not really there yet, but just something kind of mindful if we're talking big picture. Sometimes there's other organizations, there's other groups, there's other supporters. You're all pushing support of pharmacare bill or something, right? But there's nuances. There's differences of opinion. How do you navigate that? And I've been on the side where it was very contentious. Like we all want the same thing, but this particular thing that's on offer, there's disagreements, right? And setting expectations when you're working in partnership. And I'm a big believer about building coalitions and allies. There does take some navigation on that, and making sure everyone's working towards the same specific goal, and also there's flexibility for differences of opinion. Now, if we're talking about the political, social, and media context, it's challenging right now, right? We know it's, specifically for the issues that you're working on, but it's not only mental health and addictions, it's a lot of different issues. We know what's going on down south. Won't give commentary, I'm just pointing it out. We know that trust in science, we know the rise of disinformation. We know there's more individual attacks, including on physicians, things that you wouldn't necessarily expect years ago. That's the landscape that we're in, and quite frankly, it's different for me from 10 years ago, and it's something we've got to be aware of, and it's also about then picking your spots where you want to focus, and hey, this is a comfort level that I'm not reached yet. This is not how I want to do our messaging or our politics, but how can we positively make a difference knowing this is the situation? So, it's not good. Okay. This is the bad news. Don't worry, we'll get to some better news in a minute. But this is it. But those same themes, right? Truth versus falsehood, shared interest, privacy. That's not new. It's just that one side is loud right now. It's very loud, controls a lot of the information, and it's a challenging, not impossible, but it's a challenging environment. Now, there's a how do we respond to that? Well, we respond to that by taking the same approach to an extent that we would take in any of our advocacy and communications. It means being as focused as possible. Clarity of message. I cannot stress this enough, and it seems obvious until you go down to write a press release or to submit a brief or to post a key message, right? What is your message? What are you asking for and why? There are certain people, and you'll see it among politicians, that are very, very specific, right? Doesn't have to be a message shouldn't be a message that's false, that's misleading, that's hyperbolic. Leave that to the politicians. But it has to be clear. To me, from an outsider, you're trying to save lives. Say it. Sometimes the most obvious things messaging is people are reluctant to say. Right? They try to find 300 words to get to the point of what you're trying to do. Right? That's pretty straightforward. Consistency. Stick to the message. There's a reason why you'll see policymakers repeat the same lines over and over. But it's not just the message. It's about your strategy, sticking with it, right? Civility of tone. Now, that seems to counteract the other slide, but it's important. You're professionals, right? There are, my view is there are some groups that can get away with that kind of stuff, and the general public or the media consensus seems to be they expect it, so they cut more slack. Somebody else does it, then it's a big deal. It's a big surprise, and it becomes an issue. I tell my clients, especially if we're working on anything that's contentious, that there's a strong opposition side to the issue, is we can't make mistakes. The other side can make mistakes. We can't make mistakes. So that's something, in everything we put forward, in every message, in every comment, when the evidence that you put out, it has to be on point. I know that's a high bar, but that's the point. That's what's going to help your advocacy and communications. You cannot allow distractions. It's the way it is. But it's a good discipline, right? And then people learn they can trust what you're saying. Because you are the authority on mental health and addictions, right? Not some columnist for this newspaper, not some politician, not, somebody out on the street. You're the authority. You demonstrate it. Comprehensiveness of strategies and creativity of tactics. So, when you're looking at, I talked about the general things, you submit a brief, but there's other things, that you can do. Sometimes, and, it depends on what the issue is, but you want to be very visible. And you're a national organization. I've worked with other national organizations. And one of the things that you can do as a national organization is you can leverage your reach. So whether there's a day of action, right? And you people think protests and we're marching in the streets. Not necessarily. It's a day of action where you're setting up a booth somewhere in front of a hospital, handing out flyers about the work you're doing, about some evidence pieces with a few messages. Maybe everyone's going to do a talk. You're outreaching to your local Rotary Club or Chamber of Commerce or whatever the case is, and you're going to give a talk. Maybe everyone's going to write a letter on that same day. The point is, it's very difficult when you're trying to get attention just to compete in Toronto or in Ottawa with the press gallery. You can have 100 people out protesting with signs and you may not get a single news feed for it, right? You have 4 people hosting a talk in Brandon, Manitoba, you're probably going to get some media coverage about it. If you're having 10 people are going to march together as doctors in lab coats, and they're going to mail a letter to the Prime Minister saying you need to act to do more for people with da 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 da. That gets covered. You invite a journalist. Right? Use that national reach. And in return, when you start to be more visible, that generates more interest from policymakers, from stakeholders, from journalists. They'll reach out to you. And if, let's say if I'm supporting and I'm the spokesperson and I'm the media contact, they'll call me and say, hi, I'm calling up from Sydney, Nova Scotia. Do you have somebody in Sydney or in Nova Scotia that we could talk to about the local regional issues? Well, yes, we do. Right? That's one way to go about it. Use the pieces and the strengths that you have. Now, when coming together to say, okay, let's do some communications and advocacy, met with the executive and came up with some ideas of where we wanted to focus. And I'll read these, but okay. We want to position CSAM as a credible voice that can educate the public, shape the discourse we've talked about on issues affecting Canadians living with addiction and the accompanying impacts on communities and our healthcare system. That's the big picture communications piece. We want to strengthen the organization's capacity to advocate for policies, awareness, prevention, and treatment that can save lives. There's the big purpose. And improve the quality of life for Canadians living with addiction. That's how can we affect change? How can we affect legislation? And then this is key because this underpins the first 2 points. We want to build organization support, awareness, support, and capacity. Because there's only so much, and you will burn out if it's just 2 people on the board who are trying to review all the briefs or responding to a media request, or I'm calling up and saying, hey, I think we should write something on da da da. You'll stop taking my calls. You need a team, right? So we've been working on some things. I think I started in September, and CSAM's we're starting to be proactive on some things. Now, what's interesting is we came in and there's 2 pieces of legislation that want to influence. One was nearly done through the Senate. One's being proactive to the Senate. Started in the Senate, and that was nearly through the Senate. Still has to go to the House. But the first piece was Bill C-64, and the work on that is not done yet, but we'll get to it. So what did we do? We submitted a brief. The committee was meeting. We sent a letter to all the senators. We got feedback from Senator Kuchar was one that responded. I sent it to a few health journalists that I know, just so they can become aware. The bill received royal assent on October 10th. Now, the next step is I reached out to the Minister of Health's office to say, hey, we want to get moving. They referred to the Minister of Mental Health and Addictions. So we've got a meeting request pending there, because now the next step is what drugs are going to be covered in a national formulary. We know there's medicines for diabetes and birth control medicines. What else is going to be included? There's an agency that's supposed to be working on this, and then there was just a committee struck a couple of days ago that was Dr. Nav Prasad and nurse with CFNU, Linda Silas, who I know a little bit, and some others to kind of come up with an implementation plan. Big pieces, the federal government's got to get the provinces, territories to adopt it, and they've got to build a national formulary. So there's still a lot of work on the implementation, so we can be involved in that. But You contributed something, the legislation got passed, there was some contention about whether it got passed. It's a win. You contributed to a win. So S269 is the act respecting, excuse me, building a framework for our sports betting advertising, which, my goodness, if I have to watch another hockey game and see 700 of these ads with my son, it's really, really annoying. And I'm sure it must annoy all of you even more. But so this was a bill that was initiated in the Senate when we came on, it was third reading, it was second reading. It was just leaving committee. But again, we wrote something about it, submitted it to all the senators, again, got some positive feedback from senators. It went on the floor of the Senate. They had the third reading vote. It passed. So what happens next? Now the House has to take it up. Don't know the timelines, don't know how it's going to get set. But there's a couple of things we still want to do. One is obviously try to influence on the House side. I've got the Minister of Heritage will be the person responsible for it. So we've got a meeting request in there. But we're going to meet with some other MPs and ask about that. But we're also going to use this as an opportunity to have a bit more of a public awareness about it. There was one small group, I think there's a former hockey player's dad and some professors at U of T, you may be aware. They had, they had been doing a little bit of work on this a few months ago. But I think there's still an opportunity, again, as an authoritative voice, leveraging evidence, to do some media around it, maybe do an opinion piece, and we could time it to the week of the addictions week, right? But again, still work to do there. Good that it got through the Senate, but now can we get it? Can we create some noise in the House of Commons? And if not, can we do some work on it and be prepared for a post-election if this is something that CSAM wants to take up and get behind, right? Now, another big one going on, and I'm sure I'm sure many of you will be aware, the Standing Committee on Health in the House of Commons has been having a study on the opioid epidemic, toxic drug crisis. This has become a bit of quite frankly, a gong show. At committee, it's become a real thing for generating clips. Somebody comes in, could be, somebody is, and one of the other clips was about, it was the public health medical officer of health for Toronto. They quote said nothing controversial from what I could tell, but it's a post, and they call it rage farming in politics, right? This person wants to give drugs to your kids and all that kind of stuff. The point is the more somber, reasoned, evidence-based approach is not being taken seriously enough. That said, terrific brief was submitted to the health committee, to the clerk. I also sent it to all the members of the health committee directly, although they should get it, but decided to proactively do that. Sent it to the Minister of Health, sent it to the Minister of Mental Health and Addictions, and we got from the committee members, some really good feedback. The chair of the committee, MP Sean Casey, sent us a note back. One of the physicians on the committee, member of Parliament from the Yukon, Brendan Hanley, got back to us. He would like to meet to discuss. That's great. So we're setting up a time there. They're both on the Liberal side. The NDP side, Peter Julian, who's the health critic, responded, thanked for it. He's forwarded it to another one of his colleagues who's working specifically on addictions, Gord Johns, I think. And we also sent it to the Conservative members on the committee as well. So again, trying to build some interest, just some awareness. So the other thing too is we're not just thinking about today and this committee and whatever report comes out of that, trying to build some relationships. So 6 months from now, an MP proactively, they're working on something that I want to learn more about this. I remember you submitted a brief, can I talk to you? This is what happens. It happens with MPs, senators, journalists. Yes. So it's on, I don't know if it's on but it's on the House site. It is now. I know it wasn't. Yeah, it was just, it was updated last night. Yeah, no, it was updated last night. I took the clip from it. I was finishing the slide last night and I noticed it, and it said it was the last one posted and it was just updated. Yeah. Not to want to be careful here, but I would say going forward and bigger picture without inundating your members with stuff. I think one of the places that I would suggest, the organization gets to is when we have something, maybe it's a roundup at the end of the month, whatever you think is best. But there's a note goes out to the members saying, among the other work you're doing, or new research studies you want to share. But hey, by the way, we submitted a brief to the health committee, and there's a little blurb, and here's the link to read it. Again, it's showing that you're proactive. And again, you can put it on your website. You can, if you have a social media, you can post it. It's all about those things. And I did send it to, I sent it to a few journalists just as a heads up. None of this is pressing for them right now, so it's more of an FYI. But again, have in the many times journalist comes back to you later on, say, hey, I got this thing from you a while back, I'm working on this now, but do you have somebody who can comment? It's relationship building, right? And I included it in the request to Yara Sachs, who's the Minister of Mental Health and Addictions. And then the other piece, the organization responded to the Ontario government, right? Made some changes in the supervised consumption sites. Put out the organization put out a statement. It's on your website. It's great. Again, it's just being visible, being proactive, letting people know that you've got a position. And it's curious that I think Carla sent me a note that somebody from the minister's office provincially sent a note, right? I don't know if that comes from somewhere else, but it may also come from this, right? I don't know if someone else has another contact. Okay. Okay. No. That's fine. That's fine. All right. And I know I had some technical issues, so I couldn't be on that, unfortunately. But many of you met with officials from Health Canada on the department side, which is great. I spent a lot of time talking about the policymaker side, right? Of course, as you may or may not know, much of the work on the files you're working on, and just broadly, of course, happens on the civil service side and the bureaucratic side. So making contacts with the departments and officials, really important. Even just having if you can have a regular check-in once every couple of months, very important. And again, at your provincial, we're talking nationally and federally, and that's where we're focused, but in your provincial Ministry of Health as well. Many of you probably do this for your patients on certain things, but I just think it's useful for the advocacy side as well. Some of the things we still want to do, part of this I've promised to help you with, and some things we still want to do. The op-ed we talked about on S269 and the sports betting bill, right? And the outreach, again, some more outreach to National Reporters of Health. I want to. It's not pressing, but for them. But I just think I want to expand that and see if somebody wants to take a few minutes to have a conversation with Aaron or Dave or Jen or whoever, right? This other point, I think it'll be useful long term. It's called a need a source. It's just it's a piece where, this is the organization. Here's some spokespeople. Here's the issues we work on. Here's the background. If you're covering, and we can do it based broadly, issues around mental health, issues around addictions, but we can also specifically target if you want, if you're writing on harm reduction, if you're writing on safe consumption sites, and you're looking for evidence-based expert commentary, hey, give us a call, right? And we can provide some research studies, some feedback, a spokesperson, what have you. We've got the follow-up on political outreach. We've got the meeting we're scheduling with Hanley. We want to get into the mental health and addictions office. Ideally, the minister, we'll push for the minister. If you get chief of staff, director of policy, that's pretty good. And then some other MP outreach, and then as we just spoke about, trying to engage the membership a bit more, and even if we just have one or two semi-formal processes, in place, and a part of when I'm consulting, my job is not to make work for, for the organization. My job is to, propose and then see where I can take on things. So I can't propose something that I can't do. It's not, no, you're not the person to write this. But if it's hey, you know what, if there's a little advocacy blurb, I can write a paragraph for you that you can include in a newsletter, an email update, what have you, for about what you're working on. And then the other thing is, social media priorities. We haven't even really gotten into that. But where the organization is at, sometimes the organization will have a presence and will want to post something specifically. Don't know if everyone's been following the Twitter exodus to blue sky, but there's all that. But there's all kinds of platforms. I'm not as apt on every detailed platform. So what I'm suggesting to some other organizations I work with is, why don't we do it this way? Why don't you have a committee of, a handful of people that are on a few platforms and are really engaged in social media, maybe have large followings. And what we'll do is once a week or once every couple of weeks, we'll send out a couple of, short messages. We'll send out a couple of updates, links to research studies, whatever the case may be, and you post them within your networks. So that saves, the organization itself having to, rush and go and do it, being, subjected to trolls and all that stuff. But I think coming up with a little bit of a plan, because part of this is you're trying to reach grassroots Canadians, and if you're not doing it through mainstream media, and we know more and more, especially young people, they're not on it. How are you combating some of this mis and disinformation that's out there? How are you trying to educate? Well, again, that is having a presence is one way, and sometimes it's better rather than just here's the branded organization. But if it's Dave, if it's Aaron, if it's whoever from your local followers, it's a more of a trusted source, right? It's like, oh yeah, I forgot, they work in that area. I didn't know that important bit of information, right? Now, bigger picture, part of this is a shameless plug to keep working with you guys in the long term, but just for the organization, whether I work with you or not, things you'll want to consider. Certainly, and we talked about this with the advocacy committee, right? The implementation of pharmacare, the national formulary, making sure the provinces take it up, because the next piece is we don't know how the next election is going to turn out, right? There is an election coming up. I tell all my clients, you're not gonna have an issue that's going to become the issue in the election campaign. Sometimes that happens, but it's probably not. But it's really important if you can involve your members, if you can respond to maybe something that's an egregious disinformation, if you can suggest to your members, hey, why don't you go to all candidates meetings in your community and ask a question about X, right? There's ways you can be involved. Maybe it's writing a letter to the paper. Maybe it's having an opinion piece inside. We hope all the leaders are talking about this. The other thing, building an advocacy and communications toolkit, right? This is, it's both straightforward, but also can be comprehensive. It's for your members. Maybe they're looking, you're all here. You already all do this, you're fine. Maybe there's other members that are keen to engage, but they don't know who to contact. It's like, here's some specific steps for talking to your local MP, MPP, MNA, MLA, whatever the case is. Here's a template, letter the editor, and how you go about it. Here, just some background information, why they should. It's a bit of a why, it's a bit of a how, really simple steps. And you put it in a little package, and people feel empowered, right? And then National Addictions Awareness Week. There's not too much with a couple of weeks notice that we can do, but certainly at least try to maybe do a little media around it if you're game, or at least do the op-ed on sports betting. Going forward, that maybe there's a case, maybe there's provincial versions of this, but it should be something maybe the organization thinks about, and you could host small talks, reasonable talks. There's the big conferences like this, tons of planning, tons of work, costs in and out. But there's also things of, you know, we want to have a little talk on this, and we're going to go to City Hall, and we're going to do it in you know, one of the conference rooms there, and we're going to invite a couple of other stakeholders and experts, and you know, maybe a journalist, maybe throw it open to the public or not, or at least hand-picked folks, and it's a bit of a conversation, and you do it during that week to raise awareness. Maybe it's asking all your members to send in a letter with, you know, these 3 things that people should think about when they're thinking about addictions, right, and care. So you know, going forward, that becomes a signpost. And I don't know how I'm doing from time, because I've just been talking, so I'm happy to answer questions, or you'll go early. But this is sort of near the end. I just wanted to, some of this is going to apply to you guys, but some of this may apply to you in 2 years if you're doing a lot of advocacy and communications, or it's just good information to know, right? It's you know, especially if you're dealing on public policy, it's dealing with the political reality. It's also dealing with issues of compromise. If you're specifically focused on a piece of legislation or a regulation or funding for something, that's always gonna be the case. We talked before about navigating with your allies and other stakeholders, and a big thing is you know, minimizing the noise, right? You know, get off of Twitter, you know, when it's bothering you. Don't focus just on that. You know, focus on your core issues, and really staying committed to your purpose. Right? So important. I think one of the things is for individuals, for these kinds of issues, for folks, if I may be so bold, like us, who are, you know, are caring about issues of public health, we have to be as committed to our purpose as the way some of the other folks who are casting doubt on science and sharing, and you know, and shared interests and that sort of thing, are committed to their beliefs, right? I think there's a bit of there's an energy gap, there's a commitment gap, and so that's you know, that's something that I would keep in mind, right? And you know, maintain a sense of humor. It's really important. I do this for a living. I enjoy the advocacy. It's a lot, you know, it's a lot of work. It's stress at times, but it's also a lot of fun. It's a real great way. You every day in your work, you're making change on an individual level. Coming together, things like this, you make change on a macro level. You know, really, really, really great. I've had a lot of wonderful experiences working with some really terrific people and organizations. And you know, when you see something that, you know, you've been working towards for a long time, you see that change. It's really fulfilling. And you know, it's having an impact, and it connects to the work that you do every day. So that was it for my formal presentation. Happy to discuss, answer questions, hear your ideas.
Shut out your questions for the time being, but maybe Chris, you can repeat them.
Yeah, sure, of course. Well, there's a few things that okay, so the question was about preparing for a national election. And, you know, what steps could an organization like CSAM undertake? Could be a couple of different things, right? It could be, do you have any members who are involved in the election? Do you have any members of, presumably you would know if somebody was running for office, but do you have somebody who's working on a campaign? Right, our member in Coquitlam's working for the local Conservative candidate here. The member in you know, in Sherbrooke is working for the Liberal or the Bloc candidate there. That's good information to know, because what you try to do one way is to build relationships post-election. Oh yeah, well, Aaron worked for this candidate and Dave worked for that candidate. Sorry, I'm going with the names. Kirsty worked with this candidate. one of them's now a member of parliament. There's now an in there, right? It doesn't mean go out and be partisan for the sake of partisan, but if you're already involved, it's kind of good if you can share that information ahead of time. Do you want to influence a policy platform with any of the parties? We'd really like maybe sports betting as an example, but there's many others I know. But maybe it's what, this is not going to get through the House before the next election. We would like a party, all the parties ideally, to put it in their party platform that if they're elected, they're going to move forward on legislation and building a framework around sports betting and advertising and trying to control, regulate some of these ads. To do that, you've got to identify, all right, who's working on the platforms for the parties. It's an outreach to them, right? It's asking, could we meet with them? We want to talk about this issue. Part of it is getting your, what is we want to focus on during the campaign? Well, it would be really terrific if we could have any members who we could get to send this pre-written letter to their local candidates asking for their opinion on these. Where do they stand on these 5 issues? So what are the 5 issues you want to be asking about? And you prepare that in a letter. You prepare a cover letter for your members. They can go to their local campaign office. They can email it to them. They can attend an all candidates meeting and get that feedback. We then get a sense of, oh, okay, these candidates, these particular candidates are, they got 5 out of 5 in terms of where we are on these issues. If they get elected, let's reach out to them post-election. Do we want to have a media presence? What are we saying? Social media. You're not getting involved in the campaign. You're not vote for these guys, don't vote for these, none of that kind of stuff. It's just about ensuring your issues are part of the discussion and starting to build some relationships. Does that help?
I can't wait. What did you put in the brief to the House Standing Committee on Health, and how did you arrive at whatever you put in there?
So you should come to our policy meeting. Yeah, you want to come up.
Yeah.
This is being recorded.
What I meant is, yeah, if you said I'm interested in the policy, like, oh yes, I'm interested, right? I didn't tell them.
Yeah. So, I mean, the brief is now on the HESA website. So, I will give you the website. We can talk offline about it. It's nothing. I will say it's highlighting things that are really commonly known to all of us, that maybe our government officials and our legislators aren't super aware of. So providing really a basic overview of the impact of the opioid crisis and toxic drug crisis, and the position that any effective response to the current state of affairs in Canada, also one part of it needs to be a coordinated response to addiction care. And we had 5 main kind of asks as part of our recommendations to the committee. One was around pursuit of decriminalization in a way that balances, essentially in a way that is evidence-based, based on successful decriminalization policies. And Angie, help me if I mess anything up. The second one was around a structure for prevention and early intervention, and supporting our provincial and territorial governments in terms of using evidence-based prevention to look upstream for substance use. The third one was around pharmacare and the inclusion of substance use disorder medications on the National Pharmacare Plan, specifically opiate agonist therapy medications because of the direct relation to the opioid overdose crisis. We also included in there, though, a comment and a request for the federal government to decrease the barriers to bringing in injectable naltrexone as an alternate treatment option. Fourth one was Canada Health Act, update the Canada Health Act to broaden availability of first-line treatments for substance use disorders outside of basically hospitals and doctors. Yeah. And then the fifth one was essentially develop a substance use strategy. So substance use and mental health strategy. Yeah. Yeah, so our plan is to include basically the high-level summary, which is at the end of our brief in one of our upcoming newsletters. Yeah.
I've really got nothing to add, just to reinforce that these are basic, broad-level, simplistic things, and they're not polarizing, they're not ideological, and I think they're just common sense to all of us, but they're not necessarily to policymakers. So I thought it was quite important that we put our, last remaining energies into producing some of these things. And the fact that they haven't immediately shown up on the CSAM website is more a testament to the extra energy it takes to actually do the things. But it is publicly available, and Chris has shared the link in one of his slides. Yeah, it's posted. The committee itself posts them.
I can help you find it.
Yeah. Other questions?
Yeah, so thank you for the question. The question was about the use of petitions. And you mean formal petitions like that, the House mechanism, the parliamentary mechanism for a petition? Sure. Sure. So petitions as part of advocacy versus maybe asking people to write individual letters or submit a form letter, template letter to their member of parliament, having a particular issue, a resolution, and then asking people to sign it, and then having a member of parliament present it in the House. You can use petitions for other means too, and then there's also a particular process for a parliamentarian submitting a petition that's gathered names, or you just as a constituent, you can ask an MP, and they usually do it. The thing it is a good thing. There's kind of two schools of thought on this. Some people love it. They'll get lots and lots of names, and they'll use it. Quite frankly, you need to have a lot of names, right? We're in a time now, in the internet age, in the social media age, you have something, you may work really hard. You got 500 people to sign this petition, which really back in the day would have been, that's really great, right? On this, and it's like, yeah, but I got 1,000 followers on TikTok or whatever, and it's some, just some random person. How does that compare? And then it becomes, oh well, you don't have a lot of support for your issue. I'm less on quantifying it in this age, because for the kind of issues that we're working on, you're working on, so you're never going to compete with numbers. Now, it doesn't not have a role. It's just, it might be an easy thing to get people involved. If you're doing it for the purposes of raising awareness to the person signing the petition, of having an excuse where you've got a table at the farmer's market or the whatever, and you're asking people to, to sign this petition, you're using it as a way to educate people, then it's great. If you're using it just as an advocacy goal as well, other than it's an excuse to get an MP to stand up. But just as equally, you could have a member of parliament stand up anytime, but say specifically during Addictions Week, and give a 1 minute member's statement where they're gonna, read more or less verbatim, a CSAM statement. I want to take this opportunity to speak about the hardworking physicians that are working on mental health and addictions, and they're concerned that we should be putting evidence into treating people, that kind of thing. That's just as powerful, goes on the parliamentary record. And
I once posed the same question to provincially to one of the MLAs in Nova Scotia, and his answer struck me a little. Yeah, he said, "Oh yeah, no, people come to my constituency office and they have these petitions, and they're not asking me any specific question. They're pointing out something. We stand for this. We stand for that. There's a bunch of names. Say thank you, acknowledge it." And realize that what I have in front of me, I read it, and if it's something that strikes me as something that speaks to my values or that of my party, great. If it doesn't, I just either throw it away. And he said, no, you don't throw it away. He said, this is a list of people who aren't going to vote for you. So we take this list and we deliberately, help it to feed our campaign by not focusing our energies on changing these people's minds. So there's more to it than just this petition will get some action down the road. And I don't really understand the nuances of how politics work, but this gave me just a slight insight about what's the thinking on the other end when advocacy efforts happen. I never quite know how it's received.
yeah, just and just very quickly to follow up, there's a really good book, Shopping for Votes. Susan Delacourt, she's a columnist in the Toronto Star. She wrote it, and I think she's updated it a couple of times. And she speaks to some of that, how marketing has kind of worked its way into politics, both in terms of the list building, but also that, exactly as you said, the provincial politician said, who not to contact. That never used to be a thing, right? You'd go to door and they're with you, who your supporters are. Now it's they want to know who's not your supporters, and they don't even try to persuade you, right? And so much of we talked before about rage farming. So much of that is building your base and only talking to your base and making sure your base is committed. And as long as your base is one vote higher than the other team's base, that's all that matters. It's where polarization comes in. It's really bad for democracy, but we'll save that for another day. Do you want to? What outlet are you with, sir? Okay, nice to meet you, Adam. Do you want to like? It's just, I'm happy to.
I guess I can start by commenting that, traditionally and to this day, these conferences have been gatherings of clinicians. We're a community, and this is to share science. We've never really had much of a public face. It's been mostly a support community. So we've never really had a need or even really a desire to engage a lot with the wider public and to have a lot of this advocacy and promotion take place right at the very beginning of it. So this is what you're seeing. And from my standpoint, anybody's welcome to come to these conferences. If you have an addiction, an interest in addiction medicine, please come learn. Doesn't matter to me what the background is, but the point I was trying to make is, like, we haven't had a strategy because to date there's been really no need or no purpose for one.
where you want to focus. And I'm just wondering if you could comment on like the relative weight of like bills that are in the Senate versus say private member bills in the House or government bills in the House in terms of directing efforts, if you know what I mean. Like if you could only advocate for one thing and you were in support of each, like if there were a, you know, one of those bills in each of those places, I assume it would make sense to support the government bill because that's the one that's most likely to pass. And how many bills that start with the Senate actually get passed in the House? Do you know?
So thank you for the question. Sort of two parts. Question was where to prioritize our advocacy efforts around what types of legislation is going through, whether it's a government bill coming from the House side, whether it's a private member's bill, or whether it's a bill initiated by the Senate. And then how is it likely for a Senate bill to make its way? Really quickly on that, I don't know for sure, but it does happen. There's I think, and I could be wrong, the school food program may have come from the National School Food Program legislation piece, may have come from the Senate, but I could be wrong on that. But there was another, often what'll come from the Senate bills that go through is things like a national strategy, around brain injury or something. And maybe I'm confusing the two, and that's the one that came through the Senate. So it does happen. Usually it's around frameworks, national strategies, not a specific, certainly not a money bill and things like that. If you have to, if to me, it would be a problem you want to have that the government of the day is putting forward legislation that you happen to support, and a private member's bill is putting forward legislation that you support, then sure, all things being equal, go with the government bill. There's less hurdles. That said, talking about when we were talking about that press conference before and access to medicines legislation, that was a private member's bill. And that was what ended up going through the House. It actually stalled on the Senate floor because an election was called. So that was kind of, but it got partway through the Senate before the election called 2011. But that was a private member's bill, and the upside with that is there's sometimes more opportunities to shape with the individual, because the person probably bringing it forward is probably a champion of your cause. You can work with, have some influence, but there's certainly, there's getting on the order paper of Parliament and getting time for debate is certainly more challenging. You've got to get buy-in from at least some members of the different parties. So he's certainly more challenging, can be very rewarding. And if you're going to go a private member's bill route, make sure you at least think it in theory has a chance that the parties will allow a free vote on it, and it starts early enough in the term that it can get through.
I know in the past, CSAM as an organization doesn't necessarily deal with things provincially or comment or take a stand on something that is happening in a specific province. We did make this statement for what was happening in Ontario. But for those of us that are like regional directors, provincial regional directors, what is your advice or moving forward for each of us provincially? Like, we're like apolitical, and we're not saying I only want to go talk to a certain political organization, but when it comes to us that are provincial and all of us have different parties that are in, how do we kind of navigate that? And for those of us trying to do work in our own province, like, I guess I'm trying to say, like, your advice moving forward for each of us provincially versus federally, and like, is that a good place for our organization to kind of go?
Maybe a good opportunity to introduce something into your toolkit that's like, these are the different species.
Yes, yeah.
Like an organization, is it also good for a national organization to have our own individual pockets where we're focusing provincially?
So the question is balancing federal policy issues, provincial policy issues. So, yeah. 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 So a couple of things that this speaks to. One is organization structure, and as your consultant, I leave that to no, but seriously, right? Because you can have provincial wings, you can do all kinds of things like that. Um, but the bigger issue is it really comes down to capacity. And ideally, you'll do both, right? Health is a shared responsibility. You want to be active at the provincial level. That would probably mean from say you're the advocacy committee, right? Is trying to have as many representatives from different provinces on that committee, so at least there can be a minimal staying in touch on what the issues are. Now, if there's something where again, day-to-day issues, you're dealing with your provincial government, you're dealing with your provincial ministry of health more often than you are federally. But um, hot button topics, something that we really want to be involved in as a national organization in Manitoba, in Alberta, in Quebec, wherever the case may be, then we're ready to activate. Most national organizations, most of the organizations I work with, especially on health, are national. They run into the same issues. Would love to be involved provincially. They're stretched too thin. There's a really, really big issue in this province, so they'll go all in. But that's the main challenge. Certainly for a toolkit, we can include the provincial aspects, contacts, same thing. Many of the approaches is still the same.
Yeah, I guess I have a response to that, and because we've really thought about it and talked about it now for quite a long time and agonized over it. And it's easier for me to comment now that I'm the newly minted past president. But I think what we came up with was, with respect to issues that arise, even if they're, local, municipal issues, or provincial issues, whatever, that if they have a national relevance, if this is something that speaks to the overarching either community of providers, patients, landscape, if any part of it has to do with something national, I think as the only really large national addiction medicine society, I think that's part of our duty is to pay attention to it. And if we have the bandwidth to lend our energies to give some kind of, you know, acknowledgement of it, even if we can't really mount a huge response, but there is nothing else from my standpoint. But it has to have that national, to me, national relevance. But the newly minted president may have other opinions.
Oh, I don't have other opinions. I'm just going to expand on that a little bit, because I've been reflecting on this a lot, actually. And one of the things that I think that we've struggled with a little bit as an organization is, and that we've talked about actually at some board meetings, is what is the value of being part of this organization for members? And so I think this is where that value can really shine, is to leverage the organization to be a voice on those really key topics. And so even at our board meeting a couple of days ago, we had some conversation around like, what am I supposed to do as a regional representative, right? And if and I think that's something that we can build upon as an organization, as creating those regional representative roles as your go-to person for the organization if you're a member in that region, and you have something that you want the organization to be aware of and talk about, if we see this as something that that is an issue that has that national level of need for a response. So it's still an evolving thing in my brain, but that's where I see some of the potential. Yeah.
Thinking about this, and if somewhere in the bandwidth, and ultimately costs the organization has to be again, studying like interprofessional collaboration. I found out 2 weeks ago from a patient who was a lawyer, that there's like a national, criminal lawyers have a national conference on opioid crisis and health professionals. And there was a certain irony, so just also, if it can be put on the list of to-dos, for sure, I need to do something.
I can respond to that, Chi-Ten, and I'm going to paraphrase. I think what you said was you have an interest in enhancing interprofessional collaboration, and that you see a space for your leadership role in that realm in the organization. Correct me if I'm wrong, but that's clearly what I heard. Yeah, whenever you preface your comments with "if there's any space" or "if you have any bandwidth," realize who you're talking to. Like this is, I was exhausted yesterday. Yeah. Any other questions? We're well past time. Thank you so much, Chris, for coming and for sharing your knowledge and helping us further the cause. I think we've made 10 years worth of progress in the past 3 months on the things that we've talked about, just in the work that you've done in this last little bit. So thank you.
Thanks, everyone, and I'll stick around for a few minutes if people have questions. Thanks very much for your time.